Welcome to the Growth Mode podcast, where real conversations fuel real business growth. Hosted by Nina Labbe, media strategist with Salem Surround. Get ready to listen, learn, and grow. This is Growth Mode.
Have you ever wondered if that constant congestion, runny nose, itchy eyes, or recurring sinus pressure is really a cold, or could it be allergies? For many people in South Texas, the allergies aren't just a seasonal inconvenience. They can affect sleep, work, school performance, your overall quality of life. And for some, allergies may even be connected to more serious conditions like asthma. Joining me today is Dr. Lukena Karkhanis, Dr. Lukena Karkhanis, Medical Director of AllergySA and a board-certified allergist and immunologist. She specializes in helping both children and adults find answers from relief from allergies, asthma, food allergies, and immune-related conditions. Today, we're going to separate fact from fiction, discuss the most common allergy triggers in South Texas, talk about testing and treatment options, and help you understand when it's time to seek professional care. Dr. Karkhanis, it's so great to see you. I'm so excited to have you on Growth Mode.
Thank you for having me, Nina. It's great to be here.
A pleasure, a pleasure. All right, let's start from the beginning. We're going to talk about your journey into allergy and immunology. And for those who may not be familiar with your background, can you tell us a little bit about your journey into allergy and immunology and what drew you to this specialty?
So I think one of the big things I like about allergy immunology is that I get to treat children and adults.
Yes.
So my day is full of surprises. I could see a little baby and then I could see a grown-up.
Yeah.
I get to treat a variety of conditions. It's not limited to a small part of the body. Mm-hmm. And as allergists and immunologists, we are often asked questions about all the weird stuff that happens to people because we are the ones that are often tasked with finding out, is this an immune issue? Is this an allergy? And so that kind of detective work is what really drew me to the field.
Right. Awesome. All right. So allergies seem to be affecting more people than ever before. Are allergies actually becoming more common, or are we simply diagnosing them better today?
I think it's a little bit of both.
Okay.
Especially in the United States and countries where we have very clean houses and environments. When we grow up as babies in very clean environments, we call it the hygiene hypothesis. So it's like your immune system doesn't have anything to do. There's not enough germs around to fight, and it starts misbehaving, and your immune system starts thinking, innocuous things like pollen or food are dangerous. Wow. And that's how allergies start up, is that your immune system is kind of left idle, and then the idle mind is the devil's workshop, and it starts developing allergies to things that other people are tolerant to.
Oh my gosh.
And so you find that people that grow up, example, in rural environments on farms where there's dirt and animals have fewer allergies.
This is phenomenal. I have never heard that before. That is an eye-opener for sure.
Yes.
Yeah.
So we got good at preventing infections, but then we started developing allergies as a result of our clean systems and our public sanitation and all of that.
Wow. And then I know, like, when allergy season comes around, you always know because you start seeing that green film on your car.
Yes.
And then, of course, everybody starts talking about, feeling terrible, so we always know when allergy season hits South Texas.
Very true. My husband has allergies, and the day he wakes up telling me my eyes are itching, I know that's the week that I'm going to be very busy at work.
That's
because
right.
a lot of people will suffer like him.
Yep, that's right.
And pollen, that green yellow powder or film that settles on everything, right, is one of our big allergens here in South Texas. We don't get a break. We have pollen year round.
Yeah, we do.
And so we have some tree or grass or weed pollinating all the time.
Right. Yeah, you're right. Yeah, because that's how South Texas is. You know, it's that cedar, the oak, the ragweed, the mold, and other allergies. Which one of those is like the biggest, trigger in our region? Or maybe is it a few of those?
As far as pollen goes, probably cedar in the winter.
Yeah.
A lot of it comes out, and even people that are very mildly allergic have a lot of trouble because so much pollen comes out all at once. And the second is probably oak and other oak-like trees in the spring. So pretty much Thanksgiving to Valentine's Day is your cedar season. And then March through Memorial Day is your oak season. And those are very hard for our patients here in South Texas.
Yeah, absolutely. It is. All right. So let's get into, is it allergies or is it something else? Many people assume they have a constant cold or recurring, sinus issues. What are some signs that someone may actually be suffering from allergies?
So symptoms are very similar. Allergies and cold both will cause a runny nose, congestion, head pressure, itchy, watery eyes, and a tickle in your throat and coughing. But colds will typically go away.
Yeah.
In about 5 to 7 days, you should be feeling better. So if you have these symptoms on and on for weeks or months, it's probably allergies.
Okay.
And another quick way to know is if you take some allergy medicine and you feel a lot better, you're probably having allergies.
Wow. Okay.
So sometimes we tell patients, did you try the medicine? Did you feel better? If you did, then you kind of proved to yourself it was allergies.
Yes. Yeah, that's an important distinction because I think a lot of people normalize those symptoms and they assume that it's just something they got to live with too,
Yeah, I had a patient tell me, I can finally smell again.
Yeah.
He had forgotten that he couldn't smell. And then when he got better, it was that a whole new life. And he was like, I can smell my kids' diapers, which I didn't really want to, but I can smell now. And I had forgotten that this is what a nose is supposed to do.
Oh, man.
So, yeah.
Yeah. All right, so let's try to understand the different types of allergies. What's the difference between seasonal allergies, environmental allergies, and food allergies?
So seasonal allergies are a part of environmental allergies. By environmental allergies, we mean things that are in the air, essentially. So we are talking about pollen, mold spores, pet dander, like cat and dog dander, dust mites. Those are our big environmental allergies, so things you breathe in through the air. And then the ones of these that are seasonal are what we call seasonal allergies. So mainly pollen. So cedar, oak, grass, ragweed, these are our big seasonal allergies. And then the main difference between environmental and seasonal and food allergies is that food allergies happen when you eat something. And the symptoms are usually nausea, hives, swelling, sometimes diarrhea, sometimes a very severe version where the throat and the windpipe can close up, which is called anaphylaxis. So typically those are the symptoms of food allergy. Foods typically don't cause your runny nose, itchy eyes. That's more of what you're breathing in through the air.
Okay. All right. What are some of the most common food allergies that you treat, and what misconceptions do people have about them?
The common food allergies, especially in children and babies, are milk and egg. And luckily, they do outgrow them a lot. The third one, which is scarier and less likely outgrown, is peanut. So nut allergies can be scary because they're less likely to be outgrown, and you can eat a very small bite.
Yeah.
And it has a lot of protein in it. So like a half a bite of a Reese's peanut butter cup, for example, or a bite of a PB&J sometimes has 10 times the amount of peanut needed for that child to show symptoms. And so peanut allergies can often come across as very, very severe.
Yeah.
And I think a common misconception that people have is that they will only have allergies if their parents have allergies. And that's not true. We find increasingly that we diagnose children when there's no allergy history in the parents or the family. Like this is the first generation that we are finding it.
Yeah. Yeah, that is a myth right there, because I remember my mother used to think I was allergic to penicillin because she was allergic to penicillin, and then come to find out I was never allergic to penicillin.
Right, yeah. The tendency to be allergic is genetic.
Yes.
We call it a genetic predisposition to allergy or atopy, but it's not a one-to-one. So it's not like if it's penicillin, it will be penicillin, or if it's pollen, it will be pollen. No, you're just more likely to have allergies, but you could be allergic to something different than your parents.
Okay. All right. So when should parents seek help? Like, say, for instance, parents that are listening, when should they consider having their child evaluated by an allergist?
I would say as soon as you see symptoms. So for food allergies, these can start in infancy. So less than 1 year of age, when babies are first starting their solids, is when a lot of parents will notice like hives or swelling, those kind of food allergies. And we test and treat babies as young as 6 and 9 months.
Wow.
So if you think your child has a food allergy, your baby has a food allergy, it's never too early to see an allergist and get clarification. It will often scare parents and they'll stop giving the baby other solid foods as well. And we found that avoiding foods unnecessarily, just because we don't know if the baby is allergic, worsens their risk of developing allergies. So the main way to avoid allergies is to show the immune system the foods early. When they're about 4 to 6 months of age. So don't wait too long to introduce the foods, and don't unnecessarily avoid. If you have a doubt, come see an allergist and we can clarify exactly what you need to or don't need to avoid.
Yeah, good advice, good advice. All right, so let's talk about something that can become much more serious than itchy eyes or a runny nose. Asthma can be super frightening for both patients and families. How closely connected are allergies and asthma? What are some of the warning signs that people should never ignore?
Asthma is often seen to develop in young people that have allergies. So it's almost like the allergic march starts with allergies and moves on to asthma. Asthma is scary because even today we have people die of severe asthma attacks or untreated asthma. The main warning signs to watch out for would be a chronic cough. Especially in children, there is a cough variant asthma where the child just coughs and coughs. Oftentimes when they play, they do PE in school, they're in sports, or they're running around, they will start coughing a lot. Or if they catch a minor viral cold, they'll never stop coughing. And all the other children are fine in 10 days, but this particular child is coughing for 3 weeks, right? So that's a big sign that's often missed and can be asthma. If people feel like they have difficulty breathing, usually they feel like they can't breathe out, like all their air is trapped. And then when they try to breathe out, they hear this whistling sound, which is called wheezing. Sometimes they'll describe it as, I feel like there's something sitting on my chest. So like chest pressure. Oftentimes this gets worse when they lie down or they go up the stairs or they try to work out. So these are some of the main signs that you don't want to miss for asthma.
Yeah, one of the things that I've learned, from talking with other healthcare professionals is that people often wait longer than they should before seeking help, especially, when symptoms gradually become a part of their daily life. Yeah. All right. So living with allergies. One of the things I hear people say is, I've had allergies my whole life. I just live with them. What would you say to someone who believes they simply have to suffer through it?
I would say you don't know what you don't know. We have so many good treatments nowadays.
Yeah.
Many of them are covered by insurance, and they're not cumbersome. They're very safe.
Yeah.
They don't have a lot of side effects. And you can really change the quality of your life.
Yeah.
I think it's a common misconception that if your allergies aren't killing you, they may not be worth your attention. But I think we see a lot of problems with kids missing school, getting truancy notices, parents losing jobs because they have to stay home and watch their children who have bad allergies. And there are so many good ways now to improve symptoms and long-term decrease your allergies.
Yeah.
You really should see an allergist.
Yes. And that question resonates with me personally.
As we were talking, yes.
Yes, because I have struggled with allergies for, quite some time. And I've found myself making those multiple visits to my regular doctor and then to urgent care, until finally somebody suggested you should probably go see an allergist. And looking back, it just didn't even occur to me, to see a specialist that focuses specifically on this. Do you find that many patients come to you, years after trying to manage it, manage their symptoms on their own?
Yes, it's very common, especially since there are so many over-the-counter medications.
Yeah.
But what I find is that those over-the-counter medications are okay if you have mild allergies, maybe just one season. But most of our patients that have severe or year-round allergies only see about a 20 or 25% improvement, even if they're taking twice-a-day medications, multiple medications. And so then they don't realize that that's only 20-25% better, and there's a way to get to much, much higher levels of satisfaction.
Yeah. Well, let's shift into allergy testing. I think allergy testing is one of those things that people hear about all the time, but they don't fully understand. Can you explain allergy testing and what can patients expect, and does it hurt as much as people imagine?
No, I think you know by now. So it's pretty painless. It's well tolerated. We do it even for little children. They may not be super happy for about a minute. So allergy testing is usually done on the skin.
Yes.
Right? And it's a small toothpick-like device. It's not a needle. And it's used to gently prick the skin and place a small amount of allergen in that prick. But it doesn't go through and through. There's no blood drawn. It's not a needle, right? We pretty much put the skin test on the skin, and then we leave the skin open for about 20 minutes.
Okay.
So you just sit still with the tests on. Feels probably like a mosquito bite initially, and then it feels like nothing.
Okay.
And then you might start getting a little bit of itching if you have some positives starting to show up.
Yeah.
In 20 minutes or so, we can go in and take a look and see which marks are positive versus negative.
Okay.
And that's it. That's it. At the end of 20 minutes, everything is wiped off. There's no long-term kind of skin marks. And you know the answer as to what you're allergic to.
Yeah, that's so reassuring, because I think many people avoid getting tested simply because they don't even know what to expect. Yeah. All right. So let's talk about immunology. Beyond allergies and asthma, allergists also deal with immune system disorders. Can you explain what immunology is and when someone should seek specialized care? So
as immunology specialists, we basically deal with conditions where it's the opposite of allergy. So allergies are when your immune system is reacting in a hyper fashion to something. But then we have people whose immune system goes low and they develop what we call an immune deficiency, where their immune system stops fighting even common viruses and bacteria like it should. And that's the part of immunology that we deal with, is immune deficiency. And these people will often come in and say, I'm having sinus infections, I'm having pneumonias back to back. Every time I get bronchitis, I don't get better for 2 months. I never get better with the first course of antibiotics that's given to me. I'm now needing 2 or 3 changes every time. Children will often say they have ear infections. They end up getting ear tubes. They end up getting multiple surgeries, like tonsil surgery, sinus surgery. Sometimes we'll find patients that end up having such severe infections they have to get admitted and put on IV antibiotics, like the oral pills don't work anymore. And they'll often say, I get better, but in 2 weeks I catch my next infection. And people around me are not that sick, and I'm sick all the time. I'm on antibiotics all the time. These are the cardinal signs that should prompt somebody to think, maybe I should see if my immune system is becoming deficient.
Yeah, great tips. All right. So I always like to leave, listeners with practical takeaways they can start implementing right away. What are some practical things that families can do at home to reduce allergy symptoms and improve their overall quality of life?
So in our homes, most of our homes now have like this open kind of floor plan, right? So I say focus on the bedroom. Because to make changes and have them be effective, you do need a kind of enclosed space. It's very hard to make changes in the whole house. And most of us spend 8 to 12 hours in our beds, in our bedrooms, even if we're not sleeping the whole time. So a good sign would be to always try and keep your pets out of the bedroom. Even if you love your pets, don't sleep with them. Don't let them get on your bed. Train them to sleep in their own beds outside. Try and avoid carpet and rugs, because surfaces like carpets, rugs gather allergens, and vacuuming doesn't get rid of allergens. It's a misconception that vacuuming can do it. It can't. And so tile or vinyl or hardwood floors that you can mop are easier to keep free of allergens. Put covers on your mattress and pillow, because that's the other place where allergens will gather, is mattresses and pillows. So you can buy mattress and pillow protectors. Try and not let your kids sleep with stuffed animals, soft toys. Those gather a lot of allergens, and a lot of kids love to sleep with them, and then they're breathing them in all night from their stuffy. And so try and get vinyl or leather furniture. Try not to get upholstered furniture. And change out your filters in your HVAC system. Especially in South Texas, you have to be very careful. You have to keep your HVAC going. From heat to cold to heat. Don't be tempted to leave your windows open. If you have pollen allergy, mold allergy, it's all going to come inside. So you sleep with your windows closed and keep your air on. And that will filter it.
Wow. So many things to think about. What about the air purifiers? Do you recommend those?
A HEPA purifier or a HEPA filter will again work for like an enclosed bedroom. It's not going to work in a big open area, but a small office or a small bedroom where you can close the doors and windows, yes, it will help.
All right. So one of the things I love about conversations like this is, helping people understand that they don't necessarily have to accept feeling miserable as their normal, So what's one piece of advice that you'd give to someone who's been struggling with allergies, asthma, or recurring symptoms and may have been, putting it off to get help?
So keep in mind, we have ways to treat you that will make you 70-90% better compared to the 20-25% that your over-the-counter treatments may be getting you. So see your favorite allergist, whoever they may be, right? Come see us if you want to. But we have very safe, very good medications. We even have natural treatments like allergy shots, which are not really medication, but help you develop your immune tolerance to allergens. We have injections for food allergy, for asthma. If you can't do injections, we have tablets, we have drops that you can take under the tongue.
Wow.
So give it a chance. You never know how much better you could be feeling.
So much eye-opening information. It has been, just a wealth of information.
Thank you.
Yes. So before we wrap up, Dr. Karkhanis, you've shared so much valuable information with us today. If someone would like to learn more about AllergySA, schedule an appointment, or connect with your team, what's the best way for them to do that?
So you can go to our website. It's allergysa.com, or you can call us. It's our number is 210-616-0882.
Okay.
And we can have somebody help you on the phone. We have 2 locations. I have other doctors and PAs that help me.
Okay.
We try and get people in as soon as we can, sometimes same day or next day.
Yeah.
Because we really want to help the community here.
That's excellent.
And we have a lot of allergy sufferers.
Yes, we do. Awesome. Dr. Karkhanis, thank you so much for joining me today and sharing all your expertise with our audience. I just can't thank you enough.
Thank you for having me, Nina. It was a pleasure.
Absolutely. Absolutely. And, what I appreciate most about this conversation is that allergies, asthma, and immune-related conditions affect so many people. Yet, many continue to suffer unnecessarily because they assume their symptoms are normal or something they simply have to, live with. Today, we learned about common allergy triggers in South Texas, the connection between allergies and asthma, food allergies, testing options, treatments, and practical steps that families can take to improve their quality of life. If you're struggling with recurring symptoms, don't ignore them. Getting answers can make a tremendous difference in how you feel and function every day. And if you want to learn more about AllergySA or schedule an appointment, be sure to connect with Dr. Karkhanis and her team at allergysa.com. And if you enjoyed today's episode, make sure to give it a like, a comment, and subscribe so you never miss a conversation to help you live healthier, work smarter, and grow. And if you're a business owner or a marketing leader looking to get found and get heard, we do offer a Get Found, Get Heard package. It combines organic SEO with targeted radio to help businesses increase visibility, build trust, and generate real results. You can reach me anytime at growthmode@salemsurround.com, or you can call me at 210-526-3626. Until next time, keep learning, keep growing, and stay in growth mode.
Thanks for listening to the Growth Mode podcast with Nina Labbe. Stay connected, keep learning, and keep growing. Don't forget to like, subscribe, and share. And we'll see you next time on Growth Mode.
Want to grow your business online and on the air? Right now, when you sign up for a 6-month organic SEO campaign at $3,100 a month, we'll include a free radio schedule, 1 week per month for 6 months to help kickstart your visibility. That's a $5,000 value in radio advertising, designed to drive awareness and leads from day one. Don't miss it. Email Nina Labbe at growthmode@salemsurround.com or call 210-526-3626 to learn more.